Welcome to Lourdes Medical Staff Orientation. I am Dr. Lisa Harris, Senior Vice President of Medical Affairs, the Physician Network, and Chief Medical Officer. Lourdes is a member of Ascension Health. Ascension Health is the largest faith-based organization in the United States. We practice what is called faith-based healthcare. Lourdes being a member of Ascension Health means that we have centralized processing, purchasing, patient care models, etc. There are over 120 member hospital systems across the country affiliated with Ascension Health. Our motto is healthcare that is safe, healthcare that works, and healthcare that leaves no one behind. We have model communities that are rooted in Jesus as healer. Ascension Health is a much larger organization that's part of Ascension. So the Ascension Health Alliance is a Catholic healthcare organization that's dedicated to the transformation of healthcare through excellent clinical care. There are travel services, clinical resource management, and healthcare management, all affiliated with the Ascension Alliance. As you can see from this map, Ascension Health Ministries has multiple hospital systems across the country. Let's move on to medical staff responsibilities. Active staff members are required to care for unassigned patients, assume emergency call, participate in committee service, evaluate other members of the medical staff during their provisional period, to teach medical students, house staff, and other nursing services, participate in ongoing professional practice evaluation, peer review performance, and improvement projects, as well as accept consults. Medical staff are also responsible for participating in CME. You are required to obtain 50 hours of CME during your 2-year credentialing period. There are multiple opportunities for CME at Lourdes Hospital, including the Learning Lunch Network and Schwartz Rounds. These occur weekly and award 1 hour of CME credit for participation. You're also required to participate in co-management of patients when indicated, to attend applicable meetings, to pay application fees, dues, and assessments. Active staff, however, may request to be excused from emergency call after 25 years of service. It is subject to department chair review. Additional on-call responsibilities. Call is arranged within your group or your department. There may be additional emergency department call coverage for quote-unquote service patients. Service patients are those patients who present to our hospital that do not have a physician associated with Lourdes. You are required to have a mechanism of coverage if you're absent. So if you're taking vacation or attending a conference, you have to make sure that you have arrangements for your patients to be seen. Coverage can only be with a Lourdes credentialed provider. Evaluation of the emergency department patient, or if a patient is referred to your practice from the emergency department, constitutes the establishment of a doctor-patient relationship. You are required to see, treat, or assess the patients that are present to Lourdes emergency room, and you're responsible for continuing that care until the problem has been resolved or other arrangements are made. This is called the resolution of the episode of care. Let's move on to ongoing professional practice evaluation, OPPE, focused professional practice evaluation, FPPE, and peer review. Ongoing professional practice evaluation is sponsored by the Joint Commission and requires an objective review of every credentialed provider with every 8 months of their service at a particular participating hospital. There are several components to the ongoing professional practice evaluation. This may include quality review, patient satisfaction, patient complaints, commendations. It is performed by the medical director and the department chair. A focused professional practice evaluation occurs at initial appointment for 90 days. If a private provider or a practice concern is identified, a corrective plan of action is instituted. This is specifically called the focused professional practice evaluation for practice concerns. In addition, we also have peer review, or the PPC, which is the Professional Practice Committee. This is a collegial intervention for identified practice concerns. It's triggered by an event reporting system or quality issue such as an unanticipated death, unplanned readmissions, or unexpected surgical complications. In those events, an automatic trigger is sent to the Professional Practice Committee, who reviews the case and determines if the care was appropriate or if a focused professional practice evaluation should be instituted. This again is collegial and is designed to improve the care that we provide at Lourdes. Patient care conferences may be ordered whenever there's a conflict regarding patient care or management, if there is a concern regarding discharge, or if a concern arises regarding readmission. A patient care conference should be called and the care manager is consulted. They will convene a multidisciplinary team to objectively review the case and provide recommendations. We also have ethics consults available. Ethics can be consulted when there is or the potential of an ethical dilemma, when there's concerns regarding advanced directives, concerns regarding healthcare proxies. Please remember that prior to the use of a proxy, the determination of lack of capacity must be established and the form must be completed and documented within the medical record. Disclosure. If you have an affiliation or an agreement or a contract with any other institution, with a pharmaceutical company, a medical device company, this must be disclosed to the medical staff office. The federal government has recently instituted the Sunshine Act, which reveals payments made to providers by any external corporation, company, pharmaceutical device manufacturer, or pharmaceutical company. So you must report to us any pharmaceutical teaching, if you participate in upstate clinical campus or any other university teaching, if you participate in UHS residency programs, etc. We have multiple opportunities for teaching. Lake Erie College of Osteopathic Medicine. We just began in June of 2014 our first cohort of third-year medical students through Lake Erie College of Osteopathic Medicine. We are applying for a residency program for family practice, again with Lake Erie College of Osteopathic Medicine, that will begin in July of 2015. In addition, we have opportunities to become a clinical professor with an upstate clinical campus in Syracuse, New York. There are both medical students and residents associated with upstate clinical campus.